policy along with economic policy?
Look, I think they're doing all they can do, but the guidance really focuses on trying to prevent spread within the daycare center. I think we need to focus a little bit more attention on trying to prevent introduction into those settings, because once you get an infection in that setting, it's hard to control. You know, you got kids who don't wear masks very well. I think it's hard to ask a 2 or 3-year-old to wear a mask. Even if you keep them in social pods, they're going to play together. So it's hard to control transmission within that setting. I think we should be focusing more on trying to keep the infection out in the first place.
Mm-hmm. Well, but to that point, and you know, because I ask you almost every week, because my own kids can't get vaccinated, that's just going to continue to be a risk, right? Until the youngest children 4 and under can get a vaccine. So this portion of the puzzle, if a vaccine is greenlit for the youngest Americans, does it unlock everything else? Does this start to move us back to normal?
I don't think it unlocks everything else for a couple of reasons. Number one, we're seeing a lot of parents with young kids aren't getting their kids vaccinated. Only about 25% of kids 5 to 11 have been vaccinated. It's been very disappointing. About 18% have been fully vaccinated. So I suspect that there's going to be some hesitation with the youngest kids as well. We can't fully explain it. Also, while the vaccines prevent infection, so if a fully boosted adult has probably a 50% lower chance of getting infected in the first place with that vaccine, they're not 90% protective. And probably in the younger kids, they're going to be a little less protective against infection. So you're still going to see kids be able to get infected even if they're vaccinated. What the vaccine's going to do is protect them from bad outcomes. And we've seen a lot of bad outcomes with kids. There is some indication, if you listen to federal health officials, that they may be rethinking the vaccine in 6 months to 4 years old. And I'm hopeful that you could see some movement on trying to entertain that application earlier. Ultimately, the decision resides with FDA, but there is some indication that there may be an earlier action on that application.
Dr. Fauci said this week that it would be a 3-dose regimen for the youngest. You said best case would be March. Are you sticking with that?
Well, look, if federal health officials in the agency decide to authorize this on the basis of 2 doses, it could be out much sooner. And I think the decision matrix has changed around the vaccine for 6 months to 4-year-olds insofar as we know that the vaccine isn't as protective at preventing infection. Previously, we had data showing that the childhood vaccine for 6 months to 4 years wasn't as protective against infection as the adult vaccine. That's the reason why they pushed it out and asked for that 3rd dose. But now if the goal of the vaccine is to get baseline immunity in the kids to prevent really bad outcomes, and you're really not using the vaccine as a tool to prevent infection in the first place, 2 doses could do that. Getting 2 doses into a child can provide baseline immunity that protects them from severe disease, from hospitalization, and I think that may be why federal health officials are rethinking this. If in fact they decide to authorize this on the basis of 2 doses, it could be out much sooner, perhaps as early as early March.
That could be a big development. We